Good morning, everybody. This is Ed Wanabwa with Ed Travels, coming to you with the COVID-19 update for April 6th, 2020. Again, coming to you from Lapu-Lapu City, Cebu Philippines. And as this epidemic continues to go, we're stretching into our third week here of enhanced community quarantine. And I've got a lot to get to, so I want to dive right into the numbers so we can get into some much more of the meat of this particular episode. First of all, worldwide, we're sitting at 1,359,010 confirmed cases with 75,901 deaths. And that's an increase of 13,006 cases in the past 24 hours. In the U.S., we're at 367,650 confirmed cases with 10,943 deaths. I'm sorry, I'm adjusting this camera. Deaths, and with an increase of 646 new cases. And in the Philippines, where I am, 3,764 cases with 177 deaths and 14 new cases. So now that the numbers are out there, it's still surreal to me that I'm reading this level of numbers. And these are not just numbers. I always reiterate that these are people. These are deaths. These are families. These are people that are not going to be coming back. And these are people out there that are fighting for their lives right now as we speak. These are people that are being taken care of by those brave people that are out there on the front lines trying to save people. And also the people behind the scenes that are working to make sure that these people get their personal protective equipment, and the people that are working to try to find a vaccine or some sort of uniform global treatment that we can give to try to help save some people. All right, now that the numbers are out of the way, I want to touch on some key stories. Number one, the Prime Minister of the United Kingdom, Boris Johnson, I think it was last week, or maybe even, I think it was last week, he was diagnosed with the coronavirus. He tested positive. Well, these things have dramatically changed in his case. As of last night, he was moved to the intensive care unit. There are conflicting stories about whether he's on a ventilator or he's, they're parsing words about whether he's on a ventilator or whether he's taking the additional oxygen. But either way, I want to send my prayers out to him. This is extremely serious, and I'm pretty sure the people in the UK, whether you like the man or not, politically, he is a human being and he is fighting for his life right now. So he's 55 years old. He might be right on the brink of that. We don't know what type of health issues he has. But Prime Minister Boris Johnson is dealing with complications from the coronavirus. I want to touch on this again. The story about the shooting in Manila. President Rodrigo Duterte of the Philippines, a couple days ago, came out and said, shoot them. And see, what really burns my ass and pisses me off is these websites that don't have any standards, any morals, any scruples, any integrity, that go for clickbait. The president of the Philippines says shoot anybody that violates the curfew or the quarantine. That's not what the man said. And I touched on that not on yesterday's video or the previous video, but the video before that. He specifically said, if you are a violator of the quarantine and the curfew, and you pose a threat to my officers and to the general public, I've given them the authority to shoot you. And along those terms, a 63-year-old man, and let me read it here. I want to make sure I get this straight. And this is coming from Al Jazeera. I think Al Jazeera was the one. Said a 63-year-old man in the suburbs of Manila was drunk and had a scythe. It was like a curved knife. And he was threatening people. He wouldn't follow instructions. One thing led to another, and he was shot and killed. So you can call it what you want, but in my book, you brought it on yourself. He warned you. He's not calling for open game on people. He's not saying shoot people indiscriminately. I know some people might not agree, but you got a knife, you're drunk, you're threatening people. I'm not that officer on the scene. Could they have found another way to do it? Yes or no, but unless you're out there, then shut your power. You really don't know what happened. But the man was contributory negligent into whatever happened to him. He put himself in that position. Hey, enough of that. Also, big news, Manila, Luzon. Today it was officially announced they're extending their lockdown for another 30 days. Personally, I think we're looking at June, at least, until they start to flatten the curve. But officially, for another 30 days, here in Cebu, I really looked at the executive order that the governor, Gwendolyn Garcia, put out, and there was an interesting thing I found. There's no end date. She said enhanced community quarantine, and there's no end date, which is smart on her part. So I'm seriously thinking that, yeah, all the other provinces are gonna follow in line, and that leads to survival and what's going on. You know, the jeepneys, the trikes, the motorbikes, the grabs, the hobble drivers, the bar girls, the restaurants, the servers, the bartenders. All of these people are out of work. They're not bringing in any money. There's no income coming in. And it's terrible. It's absolutely terrible. And I'm afraid to see not just here, but what happens globally when the virus and the response to the virus is taking away people's basic fundamental ability to make a living and support their families. I can say today that the barangay yesterday brought 5 kilos of rice. Right over here, some fruit and vegetables that they just brought tonight. I'm still doing whatever I can. And I'm sure that helps, but that's a Band-Aid on a much bigger problem. Not saying that, not grateful for that, but in the long term, that's what it is. Maybe as the cases start to go down in some places, they can do modified restrictions and start letting certain things get back to work. I mean, that's the reality of the situation. But the virus sets the timetable for that. And that leads me back to, what is it, folks? Social distancing. I understand that these measures can seem to be draconian. Why we gotta do this? I'm not gonna do it. And the feedback that I get from so many people, especially Americans, man, we're not listening to that. Life goes on. We're still gonna hang out. We're still gonna do this. Well, you know what? I'm kind of thankful to say that after being in this enhanced quarantine for a couple weeks now going on, I'm kind of getting used to the social. It's coming to be second nature, and I'm kind of happy that I'm getting some quality sleep. That maybe it's a good thing that the bars are closed, at least for me. Eating healthier, getting, good 8 hours or more rest every night. But we have to understand, in order to address this issue, the amount of times and instances and places that large groups of people get together and interact are breeding grounds for this virus. So we need to stay apart for the time being. And we need to start testing and testing and testing so that we can start to find out, get a much better grasp on these numbers and see what we're really dealing with as far as infections and how it's being passed and where it needs to be concentrated on. So I beg of you, please adhere to that. I know that social distancing is inconvenient, uncomfortable, nobody wants to do it, but it has to be done. And I'm going to preach that every day that I get on here. And more importantly, we need to take this seriously. Again, act as if you have the virus right now. Try not to give it to somebody else. As I always say, I really would appreciate if you would click and subscribe on the video, and please send me some feedback. And I'll answer any questions, anything you want me to talk about, any video that you want to see. Please give me some feedback. Let's talk about this. Try to stay connected. The video chats, Zoom, and Facebook and Facebook Live, and try to find ways to stay connected. Again, if you're dealing with PTSD and you're having those issues, I always post the numbers to suicide hotlines, mental health resources. Talk to someone. Please talk to someone. We're in a marathon, not a sprint, but I'm here with you every step of the way. Like I always say, I love you, and there's absolutely nothing you can do about it. Namaste.